When I went back for my third degree, I was not eligible because I had aged out. I was 24. I was not eligible under my parents' insurance, despite the fact that my dad's a doctor, and I couldn't afford it myself, even though I was working and still going to school. So I went without for 2 years. I went without health insurance.
The state of the healthcare system is in crisis. As premiums continue to rise, many people in the United States, like Jessica Page, are finding it increasingly difficult to afford health insurance. Is it time for the government to step in?
I would say my feelings are probably more toward socializing medicine, primarily because what I see every day, literally every day, is some of the 50 million people in this country who are without health insurance, including 7 million children.
I think socializing it is going to lead to a decrease in the quality of healthcare and decrease in the quality of doctors who go into healthcare, and overall medical care in the country is going to go down.
While people on both sides recognize there is room for improvement, the issue is striking a balance between affordability and the quality of care.
I don't think the current state of healthcare is good. I see it over and over again with the current state of affairs where appropriate testing, appropriate procedures, things like that are getting denied by the insurance companies, and you either have to spend hours fighting with them or the patients don't get what I or other doctors consider appropriate care. So something needs to be done.
Concerns about disincentives for doctors, possible longer waiting time for patients, and a decrease in the quality of care raises the question, is healthcare a right or a privilege? Massachusetts implemented a health care reform law in April 2006, mandating that all residents be insured either through the purchase of private plans or state-subsidized health coverage for eligible low-income residents. Between 1960 and 2005, the share of national income spent on health more than tripled, but administration of funds is often inefficient.
Really, the majority of our dollars should be spent in wellness programs and keeping people well, because the majority of our dollars, unfortunately, are spent on the last 5 days of life. As research has shown, most of our money is spent in ICUs, in critical care units, where perhaps the quality is not where it should be. Had we invested dollars earlier in people's lives, we wouldn't be in those situations.
I would end up not buying food for myself because I don't have much of an appetite, and I would rather spend the $70, $80, $90 on a drug that will help me sleep so I could perform my job and go to school and function.
I think from a doctor's standpoint, we already have a lot of disincentives to go into medicine. It's getting much more difficult. The hassles to deal with the insurance companies to get appropriate medical care approved is ridiculous, and I think with socializing, things are going to get even that much more difficult.
While there are people in this world, certainly countries in this world, who really don't care for the United States too much, there are a lot of countries who still want to imitate our democratic system, or emulate it, and our system of capitalism, for good or for evil. But there is not one country in this world that imitates or emulates our healthcare system.